Hi, everyone. I'm Carrie Pena, and welcome to this first ever episode of House Calls, Real Docs, Real Talk. I am so excited to be here with you today. This is a new weekly show that we hope will provide an opportunity for all of us to come together and ask questions of the experts. And we hope that you will walk away feeling empowered about your health. And certainly, we don't want anyone out there to ever feel alone. So that's why the American Heart Association is beginning this new show today. And today's guest is Dr. Comilla Sasson. She is a vice president for emergency cardiovascular care science and innovation at the American Heart Association. Dr. Sasson, an ER physician, just returned from volunteering in a New York City emergency room during COVID-19. And she is here with me today to answer your questions and provide expert health advice. Dr. Sasson, thank you so much.
Thanks for having me.
First, I'd like you to talk about how important a show like this is for you as a healthcare professional to be able to speak directly to the people.
You know, I think this is a time where there's so much information and so many of us are stuck at home. And so all we can do is stay connected and try to hear what's going on outside of our kind of walls of our homes. And I think it's so important not only to have the opportunity to ask questions, but to make sure that they're personal, right? So I think the point of this program really is to have you guys send us questions so that we can answer them directly for you and make sure that we're giving you accurate information. And that's what the Heart Association has always been, is that voice of accurate, transparent information from a trusted source.
Absolutely. And to that point, throughout today's show, we will be asking a few questions of our audience, and we'd love to hear from you. To vote in today's polls, you can grab your phone and simply text AHA Live to 22333. Once again, that's AHA Live to 22333. And while we wait for everyone to join us, I want to put this question out there. And if you would just share with us, where you are texting us from so we can get sort of a pulse of who's joining us. While we wait for people to jump on in with us, Dr. Sasson, why don't you tell folks where you're located and also a little bit about your experience working in New York City?
I'm located here in beautiful, sunny Denver, Colorado. So I'm looking out my windows right now at the mountains. And I will say that that's been one of the great things about living here, is that we have so much open air space and places to play outdoors. And so, I think to me, that's really been kind of the way I've been keeping sane during these last very stressful few months that we've all had. I think everyone has to find something that works for them. And so, I think just having been in New York City and really just being able to be a part of the pandemic when the surge was happening and getting a better understanding of this very new disease process that, in my 17 years as an ER doctor, I practiced clinically, and I had never seen things like this before. So going to New York City for me was really just about going to the epicenter, learning as much as I could, helping as much as I could, and then hopefully bringing it back to my community and hopefully to places like this where we can just have that conversation and ask real questions.
And as you can see on the screen there, we're so glad to see folks jumping in and answering our poll question. And thank you so much. We are so glad to have all of you with us today. Once again, you can text your responses to 22333. If you haven't registered yet, you just text AHA Live to 22333 to join in. And now I want to go ahead on to our first segment, Health in the Headlines. Today, we're opening up with Health in the Headlines, and each week we will break down one headline that has grabbed our attention and have our experts weigh in. This week's headline is Dangerous Blood Clots Pose Perplexing Coronavirus Threat, and that is coming from the Associated Press. So, Dr. Sasson, if you could tell us a little bit more about what exactly that means.
I think part of this, again, is that we don't exactly know why, but what we have seen is an increased incidence of stroke and other thrombotic diseases like heart attacks and people who've had blood clots in their lungs because they've been infected with COVID. And we're not exactly sure what that correlation is yet. There's some ideas around it. So one, could it just be the inflammation from having COVID-19? Or is it that the COVID-19 virus is actually attacking or damaging the blood vessels? Or is it that people are just so sick, and when they're that sick, they're more prone to having blood clots because they're not moving around as much? I think, the data is still a little bit out, but I will say personally, having worked in New York City, we saw a lot of folks who had blood clots, and even people who were young. And I think what that means is that we need to watch this closely. If you have any signs or symptoms of a blood clot, for example, in your lungs, where maybe you're having that shortness of breath, can't get enough air in, those are some of those things that maybe may make you want to go to the emergency department much sooner.
Can you just speak very quickly about how important it is for folks when they're reading articles, because we're quoting the Associated Press, which is obviously a reputable source, but as a medical professional, how concerned are you about the amount of information that's floating out there, and maybe give people a word of advice about what they should do to make sure they're reading information that is in fact well-sourced and correct?
So I can't say that enough, Carrie. I think that's the most important thing that you just highlighted, which is go to your trusted sources. I think that's really important, especially right now. I don't know about you, but I am totally overwhelmed with all of the information that's coming at me from social media, from being online, from my neighbors. Everybody's got an opinion right now. And I think this just really shows you how important it is to pick those news sources that you know are going to have accurate information, who are really committed to doing that, and then try to go back to those vetted sources. And of course, again, organizations like the Heart Association, we're here because of those reasons. We want to make sure that people feel comfortable coming to our website or even asking us questions, just because, again, you have to know that the information that you're getting is correct. And realizing that with everything changing so quickly, that information may change quickly as well. And being okay with that. It's not that we're wrong, it's just that we're learning so much as time goes on, because this is also new and different. And I think just giving us a little bit of grace around that, which is, hey, look, come back to us frequently, because again, everything's changing quickly.
Well, as a journalist, that's very important to me, and that's why I was excited to be part of the show and to be able to interview experts like you so we can get clear information that is valuable to thousands of people across the country and across the world. We want to go ahead now and move on to our next segment. You asked, we answer. In the You Ask, We Answer segment, we're going to focus on all of your burning questions. And each week we will ask you to submit your questions at heart.org/housecalls to have them answered live here on the show. So let's go ahead and dive in to this week's topic. And I'll take a look here at the questions coming in. Is it safe to go to the ER in the midst of COVID-19? I'm sure you've been hearing a lot about that, Doctor. I know a lot of people have written into me on the various shows that I've been doing. So let's go ahead and ask the first question from Angela in Chicago. And she says here, as a patient, I am concerned that if I do have a need to go to the hospital, it's not safe due to the number of COVID-19 cases. Should I be concerned?
So yes, we should all be concerned right now, right? Because there is a COVID-19 outbreak across the globe. But we also know that the incidents, or how often those cases are actually happening, are very different based on where you live. And I think that's something that people need to keep in mind. We are always going to be doing whatever we can to keep you safe. I'm an ER doctor, right? So you're likely to come and see me when you come into the emergency department. But just know that accidents happen. People are still having strokes. People are still having heart attacks. And that's where time matters, especially to your brain and to your heart. And so, I think it's really important for people to remember, we have sections of the emergency department that is devoted to patients who may have potential symptoms of COVID-19. You're not going to wait in the waiting room with a bunch of other folks. We're going to take those potential COVID-19 patients to a separate part of that emergency department, for example. Or, when you do have some type of illness, what we'll do is we'll triage you using telemedicine or nurse triage line. There's always different ways to access healthcare. And I think the paramount thing for us as healthcare professionals is to keep you safe. And if you need help, we're here to help you.
And I'm going to ask a question from David in West Virginia next. But first, let me ask you, how are you and your fellow emergency room professionals keeping yourself safe?
I think this has been a big hot topic too, Carrie. It's been a lot in the media in terms of trying to think about personal protective equipment. I think the big thing is doing what we know works, and that's even what works for the general population, I would say. So wearing masks when we're outside, wearing masks when we're in taking care of you, so that we can make sure we're not transmitting virus or you're not giving it to us. And then just making sure, again, that we're doing all the things that are going to keep you safe and to keep ourselves safe. So washing our hands for at least 20 seconds, keeping distance from you if we need to. And again, at the end of the day, just know that we have what we need. We have the tools because everyone did what they needed to do to help us make sure our healthcare systems were prepared. And we have the tools to take care of you and to keep ourselves safe as well.
Now I want to get to David. David, thank you for your patience as I snuck in one of my own questions. And David from West Virginia asks, I'm anxious to know, as a stroke survivor, am I considered high risk for COVID?
Again, this is one of those areas where we're still learning so much because this is a novel coronavirus, meaning that we're learning as we go. But we do know, based on the early data coming out of China and Italy and Europe, and even parts of the US like New York City, that stroke survivors are going to be at higher risk just because of all of the other conditions they often have, like high blood pressure, diabetes, age, obesity. And so again, it's going to make you potentially higher risk. We don't know exactly what the reason is yet, but what I can say is that if you have any of these conditions, then you have to make sure you're keeping yourself safe. So that might be being at home more, and socially distancing, and staying, limiting your interactions as much as you can.
As more states begin to thankfully flatten the curve, how important is it that we all stay vigilant, that we continue washing our hands excessively and taking all of these other precautions that you've been talking about?
So Carrie, this is probably the most important thing you can do. And that's even to help us as healthcare professionals, help us help you, right? I can't say that enough. There's really only 3 or 4 things that you need to do. Wash your hands, wear a mask when you're outside. Wearing a mask in some studies has shown even by decreasing the risk of transmission by 85%. That's a ton. If you think about how much that's going to help stop the spread of disease, even in your own community. And then of course, limiting your activities so that you're not going to big mass gatherings. If you can do something, convert it to online, try to do that. And if you can, stay home or go outside and get some fresh air. Getting exercise and getting that fresh air, at least for me, is so important, just to be able to get outside. And so I think all of those things, again, if you can do that safely, that's going to keep you safe. And then, of course, at the end of the day, make sure you're taking care of yourself, right? So eat well, take your medications. The healthier you are, the healthier you're going to be if you do actually catch COVID-19.
Well, and as you're saying, get outside, get some fresh air. I mean, that's a big part of our mental health. I mean, which is, obviously a lot of people are suffering with their mental health as they try to navigate this pandemic. So that's really good information. I want to ask a question from Sarah in Dallas, home of the American Heart Association headquarters. Do patients with cardiovascular disease who have other conditions like high blood pressure have an increased risk to contract COVID? Is the prognosis worse than patients without underlying conditions?
So I think, again, the early answer is possibly yes. It is possible if you have hypertension, so high blood pressure, if you've got diabetes, if you've got heart disease, if you're in one of those high risk groups, so even just in terms of age, being over 60 years old, all of those things are going to make you more likely to potentially not even just contract COVID-19, but also to have severe complications from it. And so I think, again, it's really important to stay vigilant, to do all the things that we had just talked about, Carrie, that you had mentioned are so important. But again, the big question that I think a lot of my patients have asked me is, when do I know to call for help, right? Like, is it right away if I start to have any kind of fever, any kind of symptoms at all, nausea, vomiting, diarrhea, respiratory complaints? I think accessing the healthcare system early in whatever way that is. So even a phone call to your doctor to just say, look, I don't feel right. Something's wrong. Maybe I need to get tested. I think all of those early interventions are only going to help us diagnose this potentially a little bit sooner and hopefully prevent some of those complications later on.
And we're going to move to another poll question in just a moment, but I wanted to get your thoughts before we do on, if things continue to trend in a positive direction and more states flatten the curve, as I just spoke about, are you concerned that people will be letting their guard down too soon?
Yeah, I mean, I think that's a big concern. That's probably the one that keeps me awake at night. I know you talked about mental health and anxiety and, all of those things right now. I think for us as healthcare professionals, and I think for you guys as well, in terms of the general public and in the media and journalists, I think we're all concerned that as things get better, I think all of us start to slide a little bit, right? We're tired. We're tired of being home. We're tired of having to wear a mask. And I think, again, just remembering that this isn't, the first wave is the first wave, right? This is 18 to 24 months potentially of our lives that we have to think about these protective measures and keeping ourselves safe, but also keeping our neighbors safe as well. So yeah, I think, again, all of us are a little bit concerned, but flattening the curve, which basically just means, if we can decrease the number of active new infections, we make sure that our healthcare systems don't get overwhelmed. And then that allows us to make sure we can take care of every single person that walks in through our door.
I love, how passionate you are, and it's clear that you have such a love for your patients. And I also love that you give us some straight talk. And I think that's precisely what this program is all about. We want to take a quick break now because we want to hear from you in the audience. So you can get out your phones once again, and you can text us your answers. We're going to read off some polling questions here, and you can text to 22333. If you haven't registered yet, you can just text AHA Live to 22333. A couple of questions that we're going to be talking about. Have you been or are you nervous about going to the hospital or ER if needed during these times? And we've been touching on this, and you can see, Doctor, that 67% of respondents at this point are saying yes, that they are nervous about this. And then another question that we ask is, over the last 3 months, many of us have increased or adopted some healthier behaviors. Which of these do you think you will continue to do even as restrictions are lifted? So here's a few of the answers. I'll keep cooking at home. I'll keep walking and biking more than driving. I'll keep making more time to relax. I'll keep finding time to talk with family and friends. All of these or none of these. So, I think it's interesting because I'm always trying to look at a lot of my reporting really focuses on finding inspiration, even in times of darkness. And certainly some of these habits are potentially have long-term positive effects for us, Doctor.
Yeah, I will say I'm not sure if keeping cooking at home is going to have positive effects for my family. I'll be very honest. So good on you for whoever is doing the cooking at home, because I'm not sure if that would be better or worse for my family, but I'll throw that out there. So,
I've learned a lot of new, really healthy recipes. So that one has been working for me. And I have 2 small children, and we have been spending more time riding our bikes outside and walking because, of course, like so many parents, I was, homeschooling them and wanted them to get out safely. But some of those things I'm seeing in terms of behaviors for me personally have been positive. And I think hopefully that can be beneficial for a lot of people into the long run. I want to ask now a few more viewer questions here. I'm trying to read them as they come in, so pardon me. Consuela from Denver asks, my treatment plan, my plans have been interrupted by COVID, and I can no longer start my planned rehab. What can I do to stick to treatment during these times?
So I think Consuela asks a really important question, which is, I think a lot of folks, even before COVID happened, were having real life things happening, right? So medical conditions like a stroke, for example, where you have to go to rehab and you have to be able to do all of the physical therapy exercises, occupational therapy exercises to make sure you can get your life back on track. And I think, we've had such huge disruptions. And Carrie, you mentioned even just in terms of our own day-to-day life, right? Having to homeschool kids, having to, take on a whole new, way of having to interact with other folks, or even interact with our colleagues, for example, on online. And I think at the end of the day, if you can stick to that treatment plan, so if you can work really closely with your doctor and you can figure out a way in which to do this from home, or even with limited resources from home, maybe it's outside doing some of the things that you would have normally have done in, let's say, in a rehab setting. We've got plans in place, and most practices now are also doing some level of telemedicine or some way of doing virtual visits with you. So even if you want to have that virtual visit, let's say with a physical therapist, there's different ways to access that healthcare system. And I think it's all about asking questions up front. Be okay with asking as many questions as you need. That's what we're here for. I think that's one of the things that I always have to laugh a little bit about, is that I think people get really worried. I'm asking too many questions. What if this is a dumb question? What if, my doctor thinks I don't know what I'm doing? No question is dumb. And there's always going to be an opportunity to ask, whether it's the doctor, the nurse, the physician's assistant, whoever it is. Ask, and we will help you come up with a plan that is right for you so that we can make sure you get your rehab back on track.
And we have a question coming in from Suresh from Arlington, Virginia. And Suresh asks, I had a regular doctor's appointment coming up. Is it safe to keep this appointment? And what should I know about the risk? So we've touched on that a little bit, but if you could just expand for Suresh.
Sure. So, I think, again, it's all about doing what we know is really important, right? So most doctors' offices now are asking that patients come in and wear a mask themselves, both to protect yourself, but also to protect other folks that you might interact with. Washing your hands diligently, even taking that hand sanitizer with you so that when you're touching a doorknob, for example, walking into a doctor's office, that you can wash your hands right away and that you don't touch your face and your mouth, of course. Those are going to be some of the quick and easy steps that you can do. And then your doctor's office, again, has been thinking about this for months. We are reopening slowly. We are really trying to do whatever we can to make sure we keep you safe. If you need to be in that doctor's office and you need to have that visit, we've got those safeguards in place to make sure that we're spacing out appointments so that you're not going to have as much interaction in the hallway, for example. We're limiting the amount of providers that come into your room so that you don't have as many people coming in and out. We may even be using phones during your visit, again, just to limit the amount of time that we have to be in and out of that room. So again, just be open to it, be flexible to it, and know that things are changing really, really quickly. So again, I can't say this enough. Give us a little bit of grace as your healthcare professionals, because we're learning along with you. And so what you did yesterday, or what we did yesterday, may be different tomorrow. And that's just part of the life that we're in right now. There's a new normal everywhere we are.
And that's excellent advice. So you do, though, recommend that Suresh keeps that appointment.
Yes, very much so, Carrie. That's such an important part is, if you need care, get your care. If you need to see your doctor, do it. We will keep you safe. Most importantly, it's making sure that you're not delaying care because you're afraid of coming in to be seen.
That's so important, and that's one of the reasons for this show, is to make sure that people are getting the care that they need. I want to just forgive me, I'm looking at my phone just to check the time here so I can keep us on time with this segment and make sure that we don't waste any of the viewers' time, because we want to make every minute count. So it seems I do have a moment to ask one more question myself. I was curious to see what you think about telemedicine, because I've talked to a lot of health professionals, in particular in behavioral and mental health field, and they feel that this has been a positive, that a lot more people are reaching out, at least for that initial appointment, not feeling quite as intimidated. How do you feel about that?
I personally, as a mom of a 3 and a 5-year-old who's super busy, I think probably like you, Carrie, in many ways, I think telemedicine is going to change the way in which we think about healthcare, and not just today, I think forever. And I think a lot of these things are good things. I was able to access my pediatrician twice for my son who had a sore throat. Ended up that he had strep throat. We were able to do a virtual visit. You know what? I was able to do that without having to drive for an hour, take time off of work to do it. And so I think, again, we're going to see these great changes that happen because of telemedicine. And I will say, you highlighted probably the most important thing, mental health. I think that's not something that we're talking a lot about right now. And it's so important. And I think hopefully, because we're at home, because we're having a little bit more time to reflect and we're not running from activity to activity, I hope it also opens the doors for people for access, right? And I think that's what telemedicine really does, is it provides a way for us to access healthcare, oftentimes much cheaper than we would have had we had to go to the emergency department, for example. So maybe there's a new option for you, and that doesn't disrupt your entire day, and it allows you to connect, let's say, with a behavioral health specialist and talk about your anxiety, talk about your panic, talk about the fact that you're depressed because you're home, or you feel stressed out because your kids are trying to learn from home and you have to work. These are all normal feelings. And I think, again, the more we can normalize the fact that this doesn't feel normal, none of us feel normal right now, reach out for help in whatever way that is. And if you feel comfortable doing it through a virtual visit, through a video visit, through a phone call, do it, because again, it's just going to help you both mentally and then, of course, physically as well.
Well, and you hit on something that I'm always concerned about, and that is folks who live in rural areas or don't have immediate access to medical care. So thank you for touching on that. Thank you so much for all of your incredible advice. And I would just love to give you time to make a final statement or some inspirational words that you might have to share with the audience.
I think the biggest thing that folks can do, not only to help us as healthcare professionals, but to hopefully help your neighbors. I think everyone's actions really matter right now. And I think it's so important. Again, if you can wear a mask wherever you go outside, if you're going to be in a public location, if you can wash your hands, you can limit those activities to essential activities. And then if you can get out and get some fresh air, I think that's really, all of those things are obviously going to be really important. And then I think the last thing that you touched on, Carrie, that I think is probably the most important thing is think about your mental health and stay connected to people, because I think it's really easy right now, especially if you're living in a rural area, if you're alone at home, to get isolated and to feel lonely. And just know that you're not alone, and that there's always people here who care about you and access the healthcare system whenever you need it. We're here for you as well, especially in the ER. That's where you'll see me.
Dr. Sasson, I can't thank you enough. I know how busy you are as an emergency room physician, and you taking this time today to share your analysis and compassion and advice with the audience is just so, we appreciate it so very much. Thank you.
Thank you. And thank you for all that you're doing, Carrie, too, to help keep everyone informed. Again, trusted voices are so important.
We're all in this together, right?
Mm-hmm. Absolutely.
Thank you very much, Doctor. And next up, we want to bring you our weekly health hack. Health Hacks is brought to you by Stories of the Relentless, the American Heart Association's new podcast. It is excellent. I hope you will check it out. You can find it on heart.org, iTunes, Spotify, and of course, Google Play. So please go ahead and check out those episodes. You can subscribe and share your thoughts in the reviews and share it with your friends and family. And this week's tip comes to us from Virginia. Virginia reminds us that she shops healthy by doing two things. She loves soups. I do too, Virginia. I love this. So she loves soup. So she looks for the heart check mark when shopping in the soup aisle. And she goes overboard, if there's such a thing, in the produce department. So those are great health hacks. Thank you so much, Virginia, for sharing that with us. And remember, we will feature a new hack each week. You can submit yours at heart.org/house calls. And to wrap today's show, we want to get some final thoughts from our audience with What Would You Say? Once again, my friends, you can get out your phone so you can text your answer to 22333. Again, that's 22333. We're going to check out some of the answers that are coming in. And thank you for bearing with us as this is a live show and we're trying to bring you this information as it comes into us. Once again, we do want to thank all of you for checking out this brand new show. It will be on every Monday, I know at least in the month of June. And the American Heart Association is very excited to bring you these question and answer sessions with experts from around the country. First question here we're asking is, what is your favorite way for the American Heart Association to communicate with you so you can share what your thoughts are, whether you prefer email, social media, website, texting, or scientific journals. So email, you can see there. Right now, I don't know how accurate that number is, but right now, email is way out ahead. And we'll leave that up there for a second. I mean, the whole point of this show really is to be in direct touch with all of the followers and subscribers of American Heart Association. That is premier and at the top of the mission is asking you for your thoughts and finding out what help you need so American Heart Association can help you solve the problems and of course keep you healthy and safe. And thank you so much for those who are communicating with us and sharing their thoughts about how you prefer the American Heart Association to communicate with you. I'll switch now to the next question. Which of these topics have you been wanting to know more about? Sticking to your treatment plan in the face of COVID-19. We hear a lot about this. And also, what does the CARES Act mean for me and my loved ones? So you can go ahead and text us. And again, I'll read that to you, 22333. And let us know what you feel about this, sticking to your treatment plan in the face of COVID-19, or would you like to know more about the CARES Act? One really big thing that we're going to be doing with this show is really listening to you and finding out what questions do you want answered, and that will help us determine how we plan the next episode. So thanks to all of you for checking in with us today and for spending some time. Once again, our thanks to Dr. Sasson, who is just an incredibly compassionate expert, like so many medical professionals who are doing their best to care for all of us during this pandemic. And she's just an absolutely fabulous person as well. That's all we have for you today. We want to thank you again, and be sure to check in with us same time, same place. Next Monday, we'll be bringing you a brand new episode, and we'll be sharing more of your questions and comments with the audience. For now, I'm Carrie Pena. Stay safe and stay healthy. Take care.